Hey everybody, Dr. C here. Today I'm going to continue my conversation about the 4 pillars of pain relief. We've discussed these in previous videos and they include detox, ambulate, hydrate, and meditate. Today I'm going to discuss the ambulate pillar of pain relief. Of all of the things you can do for yourself, ambulation or exercise is probably the most valuable thing. If you don't do anything else to try and improve your pain control, I'd strongly recommend you exercise. Exercise doesn't have to be intense, and in fact, we know that as little as 1/2 hour a day, 5 days a week is beneficial. It can be as simple as just walking. We know that walking is useful for all pains. It'll help control pain from headache to back pain to joint pain. It's useful for relieving arthritis in the knees and hips, the pain from arthritis in the knees and hips. It's probably a panacea. A panacea is described as a remedy for all diseases, a cure-all. And I would say that of all the things that a human body can do to improve its function, its health, and its pain control, exercise, and in particular walking, is probably the one thing that would be most beneficial. You don't have to walk fast, but the more intensity you put into it, the better the value it will have for everything, including pain control. We know that hearts that are exercised last longer and function better. We know that exercise reduces the risk of stroke. It reduces the risk of cancer. It reduces the risk of mortality from almost all causes. There's almost nothing that exercise won't do. The beautiful thing about exercise is nobody's going to tell you can't do it either. Even if you've just recently had a total knee replacement, the surgeon is going to want you up and moving almost immediately because it's been shown that knees heal faster in the presence of activity than they do in bed rest. We know that after strokes and heart attacks, bodies heal faster in the presence of activity instead of with bed rest. And we know that all post-surgical patients benefit from ambulation, and that's why no matter what operation you've had, you will be up and walking that day post-operatively if you're able. I mean, if you're awake and able to bear weight. The problem with exercise is that it's not all that easy. Most people who have pain don't want to move because activity makes the pain worse. And the reality is, while it may aggravate the pain initially, it's going to benefit the pain in the long run. Even with arthritic joints, walking and to some degree jogging is beneficial for these joints. So if it can help an injured knee, it can certainly help anything else that might be painful. The key with walking and any form of exercise is to start slowly if you haven't been doing it. Even a marathon runner starts out by walking around the block. They don't start out by running 26 miles. And that's what you'll need to do too. And as you do it, it will get easier and it will become more enjoyable. The recommendation for walking 5 days a week, 30 minutes a day has been demonstrated to be beneficial for pain control. We also know that it works better if you're outside doing something you like rather than indoors on a treadmill watching the news. But any exercise is better than no exercise. We know that the more intense the exercise, the more beneficial it becomes. And as you increase the intensity, it's possible to gain the same benefits while reducing the duration. And by getting involved in a high-intensity exercise program or a Tabata protocol exercise program, you can really accelerate the benefits of exercise. But for now, I'll tell you, just walking is good enough. We know that exercise changes the way the brain responds to pain. And we've talked about functional magnetic resonance imaging and PET scanning in the past, and we can see actual physiologic changes in the brain with increasing levels of exercise. As people get up and get moving, the visible signals in their brain decrease. and the healthy neurological function improves. And that the more you do, the more these changes persist and the more rapidly they occur. And so while 30 minutes is a sort of baseline level of activity, by increasing the intensity over that 30-minute period, you can sure gain a lot of benefit from it. Another direct bit of evidence for the benefits of exercise and the analgesic effects of exercise are that we are able to measure the presence of endorphins in the body during and following an exercise protocol. In patients who undergo a routine exercise program, who then get their blood drawn, you can actually see elevated levels of endorphins. If you recall, endorphins are the body's own opiates. They're the body's pain relievers. And by increasing your physical activity, you increase the level of pain relievers in your body. So instead of having to take a pill for pain relief, you'll actually manufacture one endogenously. In addition to being pain relieving directly, there are some indirect effects of exercise on pain. One of the things is that exercise is anti-inflammatory. It reduces the amount of inflammatory mediators in your body. One of the big things that exercise does is it reduces fat. It causes you to lean out. And by reducing fat, particularly visceral fat, which is present in the abdomen and surrounds your organs, you reduce the presence of adipokines. And adipokines are pain-causing cytokines, pain-causing inflammatory factors within the body. Less fat, less adipokines, less pain. When you exercise a muscle, the muscles grow and they release myokines. And myokines have the opposite effect of adipokines. Myokines are pain relieving. And so that's why people feel good after a resistance workout, after lifting weights and getting that pumped up feeling. It makes you feel better because you've just released a bunch of myokines into your blood system, and that has reduced the inflammation in your body. And you've also reduced endorphins, which is also analgesic. So you're getting a twofer when you do strength training. Other inflammatory cytokines have been shown to decrease following exercise. These include specifically interleukin-1 and interleukin-10, which are known to be pro-algesic or to promote inflammation and promote pain in the body. Even for conditions which are very difficult to function with, such as fibromyalgia or other central sensitization conditions, exercise has been proven to be beneficial. It improves mood, it improves stamina, and it reduces pain over time, although the effects are more limited and the results occur more slowly. But the take-home message is, even for conditions that are thought to by most patients to get worse with physical activity, they will improve over time. The other nice thing about exercise and walking is that it can be enjoyable, because it is often possible to incorporate this sort of activity into things that are fun. For example, I really like to be outside. As you can tell, I film many of these videos outdoors simply because I feel better when I'm outside in the sunshine. And I have a small piece of property where I can come out and do work. And so I can incorporate physical activity into everyday activities that I enjoy so that it doesn't feel quite so much like exercise. Unfortunately, as you can see, I don't do enough of it because my work just involves most of my time. But I do know that on weekends when I'm available, when it's possible for me to get out to the farm and do some physical labor, I feel better, and I'm better able to face the work week that's upcoming. It also reduces my joint pain. It makes my back hurt less. I find I have improved stamina. I can stand and operate for longer, so I can do more work over time because I have less pain. And all of these things are beneficial. But I succumb to the same resistance that everybody else does, in that after I lay off for a little while, it's easy to become sedentary. I find that exercising is hard, and getting out and moving around leaves me sore and stiff at first. And so what happens is, Newton's law of conservation of energy, a body at rest tends to stay at rest. This is true. But what's also true is a body at motion tends to stay in motion. And so as you teach yourself to get up and get moving, it's easier to keep moving. And so start out today. One simple thing. Start walking. On day one, walk around the block. You don't have to go far. Maybe just walking to the mailbox and back is far enough for you if you've really not done anything in years. But as you do it, it will get easier and you will get stronger and things will become more tolerable. And eventually, activities that it used to be a drudge for you will start to become enjoyable. Hiking outdoors is very fun, swimming in rivers and creeks and in a lake or in a pool with your kids is fun. And you'll be able to go out and do more things with your children or more things with your friends. And the whole world will open up to you simply because you started walking or ambulating. And so this is pillar number 1 of pain relief. Go out and do something, anything, and slowly increase the intensity and slowly increase the duration. When you're able, add some strength training on top of it because it's good for building stamina and building function. But if nothing else, ambulate. I hope you've enjoyed this video. I hope that it's been useful information to you. Please like and subscribe because it's the only way that I know that you're paying attention and that you find this information useful. If you have comments, please leave them in the comment section down below, and I will be happy to address them in a later video. I will include some references today for research studies that I use or I base this information that I'm giving you on. And you can check these papers out for yourself and read and see what they say. And you will find that exercise truly is a panacea. Thanks for watching.